When you look in the mirror, do you see sleepy looking eyes? Maybe your upper eyelids sag a little or cover your pupil. It could be ptosis, which is a medical term for drooping. Hi, I'm Dr. Shweta Jain from iMantra, and today I'm going to be talking about ptosis. Ptosis or drooping eyelid is quite common. You must have seen some people have the upper parts of their eyelid drooping over the other one. Sometimes it can get overboard and obstruct your vision. This happens when the drooping eyelid sometimes drops so much that it starts to cover your pupil. Ptosis can be of two types, acquired and congenital. Congenital ptosis. Children that are born with drooping eyelids have congenital ptosis. This can be caused due to dysfunctioning muscle that lifts the eyelid, called levator muscle. Diagnosing ptosis in children can be tricky. Certain signs that you should look for are when the upper eyelid crease do not line up evenly with each other. Secondly, if you can't distinctly see the drooping eyelid, you should look for the signs like tipping head of the back and lifting of their chin to see better. This can eventually leave them with neck or back problems. Children with ptosis might have accompanied issues like neurological disorders, vision issues, and rarely even tumor. Having ptosis puts a child at risk of vision problems. If the child eyelid droops so much that it blocks vision, amblyopia, also called lazy eye, can develop. This can deteriorate and eventually one eye will have better vision than the other. A child with ptosis can also have astigmatism, which can cause them to see blurry images. Acquired ptosis. When the levator muscle of the eye stretches or gets completely detached from the eyelid in adults, it is called acquired ptosis. People can develop acquired ptosis through blunt trauma on the eye, or it can also occur as an aftermath of eye surgery. It's rare for ptosis to occur as a symptom of tumorous growth in the eyelid in adults, but nonetheless it can happen. Moving on, let's talk about how to treat ptosis, both in children and in adults. Treatment of ptosis in children. So before suggesting the treatment for ptosis, your eye specialist will consider the following factors when deciding the best way to treat it. The child's age, whether one or both eyelids are involved, the eyelid height, the strength of the eyelid muscle, and the eyelid movements. Ptosis in children can either be resolved through correction surgery, which attaches the eyelid to other muscles, or tugs the levator muscle, which results in tightening. The goal is to improve vision. If the child also has amblyopia, that condition must be treated as well. Amblyopia may be treated by wearing an eye patch or special eye glasses or using certain eye drops to strengthen the weaker eye. All children with ptosis, whether or not they have surgery, should see their ophthalmologist regularly for eye exams. Treatment for ptosis in adults. Ptosis surgery in adults is a minor procedure and the patient can usually go home the same day. A local anesthesia will be used to numb your eye and the area around it. The purpose of the surgery is to tighten the muscle around the eyes and reattach the eyelid with proper support. It's quite obvious that all kinds of surgeries come with their own risk. Ptosis Crutch. A non-surgical treatment option for ptosis is Ptosis Crutch or ptosis attachment. This crutch prevents the eyelid from drooping by holding it in its place. The crutch can be adjustable or reinforceable. Adjustable crutches are placed on just a single side of the frame, while the reinforceable ones are placed on both sides of the frame. Ptosis can cause problems when you drive, read, or even walk up and down stairs. If that happens, go to your doctor. All patients with ptosis should be carefully monitored and photographs should be clicked at every visit to assess any development or progress in the treatment. Surgery is not an idea you should toy with casually. Think about it if and only if your doctor suggests. For teens, surgery can improve not just vision but self-esteem. Children with ptosis should see an eye doctor regularly. If the video was helpful, please hit the like button and do not forget to subscribe to our channels for more such updates. Thank you.